One thing that really stood out to me in the recent interview was the story shared about hugging a sexual assault survivor while practicing under supervision. And I think this is exactly why ethical training and supervision matter. When you are a trainee practicing under a supervisor's license, you are not practicing independently. You're being trained to think critically, ethically, legally, and clinically. Not because survivors want to control you, but because clients deserve careful, accountable care. And with trauma survivors specifically, especially survivors of sexual assault, boundaries matter deeply. As clinicians, we're trained not to assume this person needs physical comfort. This person needs a hug. This person needs what I would want in the moment. And that's what separates us from your little friends. Trauma work is not about moving at a clinician's emotional pace, right? It's about moving at a client's pace. A client may smile, they might agree, they might comply, or even accept physical touch while internally feeling unsafe, frozen, triggered, obligated, or unable to say no. That's why we're trained to think about power dynamics, transference, countertransference, attachment, trauma responses, consent, and therapeutic boundaries. And again, the part about social media, this is the part that social media often skips. Sometimes what feels compassionate to the provider is actually emotionally gratifying for the provider. That's why one of the biggest questions I teach my students and supervisees to ask is, who is this for? And I'm going to keep saying that. Who is this for? Am I doing this because it genuinely serves the client, or because it reduces my own discomfort, my own emotional reaction, my own helplessness or need to soothe? Ethical therapy is not just about intention, it's about our impact. And honestly, I think that's what gets lost in these conversations around licensure. And so that's why I got many videos. Okay. People hear rules and think restriction. But many of those rules exist because mental health professionals are trained to recognize how easy it is for our own emotions, beliefs, desires, rescue fantasies, unmet needs to unintentionally enter the room. That awareness is part of what licensure and ethical training are supposed to cultivate.